The CDC has been saying that obesity increases a person's risk for being hospitalized with COVID, and that means a lot of people are in danger. Joining us now to talk about this is Dr. Darren Tischler, Chief of Bariatrics at Hartford Hospital. Doctor, welcome.
Hi, thank you for having me.
Oh, thanks for being with us. So tell us what you know about the CDC's take on obesity and COVID.
Well, last week the CDC issued a statement that showed that just about 80% of people who were admitted to the hospital with severe COVID were either overweight or obese. We've known that to be a link, but this has really shown just how strong that link is. We don't really understand all of the reasons why patients with obesity are more at risk, but in general, patients with obesity have more disease, more risk of diabetes, high blood pressure, as well as an impaired ability to fight off infections, especially lung infections.
All right, what can people with a BMI over 25 do to protect themselves from COVID?
Well, people with a BMI over 25, or everyone in the state for that matter, can protect themselves by getting vaccinated. That is, I think right now, the most important thing we can do. We know that in the next couple of weeks that everyone will be eligible to sign up for a vaccine, and I think it's going to make the strongest impact. However, anyone who is overweight or obese, losing weight will help their health. Even a small or modest amount of weight loss can have a significant impact on the risk of COVID-19 infection.
All right, tell us about resources offered by Hartford Healthcare to help those struggling with obesity.
Well, we fight obesity every day. It's what I do. We have teams all throughout Hartford Healthcare, and we have educational seminars coming up on March 25th is our next one. And we offer full range of services from medical treatment all the way through bariatric or obesity surgery.
What would your advice be to someone who's watching who maybe has thought about it, but they're not sure if it's really effective?
Well, we have long-standing history with bariatric surgery in the United States that shows that the surgery is effective. It is life-saving in many cases. It's not a last resort treatment, as a lot of people might think, but it really can be a first-line treatment in patients suffering from many of the health problems from obesity. And the treatment itself can be life-saving in many cases.
And how about the psychological effects of people who might be considering treatment?
Well, the psychological effects, depression and anxiety are tightly related to obesity, and we've seen that to become even more of an issue in the last year with the global pandemic. You take someone who already has some health issues, combine on the isolation and the lack of activity that's taken place over the last year with the pandemic, and I think that can really build upon itself quite easily.
Oh, it's so true. It's been such a tough year. Dr. Darren Tischler with Hartford Healthcare, Hartford Hospital, thank you so much for joining us.
Thank you for having me.